Here are 8 things to avoid if you have hand arthritis. Number 1 is aggressive stretching of your fingers. The reason for this is because when you stretch aggressively, you're compressing the joints inside the fingers. These joints where the arthritis occurs, you're actually adding more compression and they're already inflamed because that's what the definition of arthritis is, joint inflammation. And so if you're aggressively stretching them, you're adding more compression to an irritated joint. Not a good idea. Now, I'm okay with gentle stretching. And the way that I would define it is on a scale of 0 to 10, 10 meaning the most aggressive you can get, 0 meaning not aggressive, nothing at all. Stick to like a 1 or a 2. So just lightly stretch it. Don't be aggressive. Be very gentle with it. If you feel like you're grimacing, if you're going, it's definitely more than a 2. It's probably more like 6, 7 and beyond. You need to stay light instead of aggressive stretching. Number 2 is strengthening your fingers. So usually people will do ball squeezes where they're digging their fingers inwards like this. There's other tools out there where they're pushing their fingers inwards. But if you're doing any sort of exercise that focuses on strengthening your fingers, that's also going to contribute to worse hand arthritis or finger arthritis, because when you strengthen those muscles, the belly of the muscle lives in your forearm, it actually adds more compression. The tendons run this way and attach to the fingertips. And so when you strengthen the muscles that bend your knuckles this way, your fingers this way, it starts to put more pressure through these joints, and over time it gradually worsens hand arthritis. Number 3 is extension exercises. And what I mean by that is exercises where you're opening your hand like this, especially against resistance. The first level that you see people typically do is they'll put their hand flat on a surface and then they're picking up a finger like this, maybe one at a time, and that's working on extension. We call that finger extension. But the next level after that is people use some sort of rubber band or stretchy material and push their fingers out into the rubber band so that they're strengthening the muscles on this side of their arm, and the tendons go all the way into the fingertips right there. I think this is a bad idea because the muscles that open your hand don't need to be very strong. If you can open your hand and your fingers go all the way into this position and you don't have any limitations, then you don't need to strengthen your hand extensors, because your extensor muscles can open your hand through the full range of motion. Therefore, you don't have a limitation. Now, people often do this because they're just trying to be general. They're trying to be comprehensive in strengthening all the muscles in their hand, but working on extension, because same thing with like the muscles that bend your fingertips, these extensor muscles go to your fingertips. And so if you get those very strong, then you're also going to be compressing the joints in your fingers. So I don't think it's a good idea. An analogy that I like to give with this is I love Steve Irwin, the crocodile hunter, and he's no longer with us, unfortunately. But I have a visual in my head of when I was a kid of him sitting on the neck of a crocodile, holding the crocodile's mouth shut with his hands. And then he was explaining how the bite force of a crocodile is so many thousands of pounds per square inch. When the alligator or the crocodile closes its mouth, and it can crush bones in an instant. And Steve Irwin, a fantastic guy. But the muscles in the crocodile to open the mouth were tiny in comparison to the ones to close, because it didn't need much strength to open its mouth. It was rarely ever opening it against resistance, but it definitely had resistance going down to how to keep an animal in its mouth. It's the same thing with our hand. We need a lot more force coming this way than we need this way. So it doesn't make sense to exercise these extensor muscles against resistance. Number 4 is putting weight through your hands. So we're talking like push-up type exercises, or maybe push up against the wall, or any sort of pushing exercises if you're doing weights like a bench press, chest press. If you're compressing in this direction, it generally just doesn't feel good for most people. If you can get away with doing it without aggravating your hand arthritis, then go forward into doing it if you feel it's the right thing for you. But I generally don't recommend my hand arthritis patients do any sort of pushing activities until we know that it is pain-free. Number 5 is fine dexterity activities. So what I mean by that are going to be activities like writing by hand, typing, sewing by hand, crocheting, knitting. Those kinds of activities can use your muscles that make your fingertips work on a consistent way, especially if you're doing this for long periods of time, like more than an hour. Even 30 minutes can be aggravating for some people. But it's just simply because you're using those fingers, the muscles that bend your fingers, these in the forearms, and you're activating them and gradually adding more compression into all these joints in the fingers. Over time, this starts to aggravate those joints and it worsens arthritis. So I know you might enjoy doing these activities. It might be a hobby or a pastime for you or something that you need to do in some cases. I would minimize it and make sure that it's not aggravating you in the long run, that you don't feel symptoms that are lingering for days after you do it. Number 6 is wrist strengthening exercises. Sometimes you'll see exercises on the internet for hand arthritis to use a weight like this and then bend your wrist this way and turn it over and go the other way. And for the same reasons as the muscles that bend your fingers and extend your fingers go into your forearm, if you've ever done these exercises, you'll feel your forearm muscles getting tired doing this exercise, and you'll feel these arms on this side of the forearm getting tired when you do this exercise. When you exercise these muscles, you're going to engage those muscles that bend your fingertips and feed into the root problem that causes hand arthritis, finger arthritis. Number 7 is living in wrist braces and finger braces indefinitely. Now, I think braces are a good idea, especially if you're flared up. Having a wrist brace on to sleep in or putting a finger splint on for a specific joint that's bothering you is an excellent idea to get the irritation, the pain levels down so that you can begin to tolerate some other exercises and movements. But deciding to just use braces indefinitely, or if you've ever gotten advice from a healthcare professional to just be in a brace and then they don't tell you when to get off, I think that's not a great idea because you need to have a plan to get off the braces at some point. My recommendation is use the braces for the period of time that you need them to get things to calm down. For some people that might be a few days or a few weeks. For others it might be a few months or the better part of a year. And that's okay as long as you feel like you're making improvements. If the brace is not really helping you that much more, then no need to wear it. There's probably something else you need to be doing instead so that you're not having to wear a clunky brace or have people ask you all the time, what happened to your finger? What happened to your wrist? What's going on? Did you break it? That way you don't get those questions, and that's less important. What's more important is that you start doing the right things that are going to help your hand arthritis rather than just keep it the same. And number 8 is finger mobility exercises. These are the most common exercises that I see healthcare professionals out there give their hand arthritis patients. And here's the thing, in my opinion, they're really simple and plain. And what I'm talking about is exercises like this where they'll say, just bend your finger this one. Now bend maybe 2, or bend the outer ones, or touch your fingers this way, or bend your fingers this way, and then bend these knuckles, and then touch your thumb to here, and they're just going through simple range of motion mobility exercises. And I wouldn't bother doing these if you don't struggle with them. Here's the thing, if you do struggle, for instance, if for some reason your joints are that stiff that you can't touch your fingertips like this, depending on which finger you're using, then yeah, go ahead and do this exercise. But if you're able to do all these, if you can do all the motions and the exercise feels easy to you, don't do it. You need to be doing something different that's actually going to be challenging for you without causing pain. But that way you can make some improvements, because simply doing mobility exercises for a lot of people with hand arthritis, it doesn't do a whole lot for them. Those exercises are intended for more extreme situations where there's significant range of motion losses. But really, what I see it benefit the most is people that have had a broken bone, a broken finger, or a surgery, because they will often have losses of motion where they do need to be doing some simple exercises like this and practicing some simple motions. But as soon as you get all that motion back, that ability, now you need to go start to strengthen with something like this or like this to start to get the muscles to work properly in the right balance. If you want more help with hand arthritis, check out our hand arthritis recovery program. There's a link to that in the description of the video here. And if you want to learn even more about the root cause of hand arthritis, check out this video. It's called The Secret Cause of Hand Arthritis That No One is Talking About.